Thank you, Mr. Speaker. The Grande Prairie Hospital was announced many times, including 2012, prior to the election, when they actually started moving dirt around, even though there was not even a plan for the hospital. Now that it's finally under construction, the Minister of Health announced yesterday that the Grande Prairie Hospital will have its services cut, it will be delayed, and it is over budget. To the Minister of Health, can you explain to the people of Grande Prairie and the Peace Country that will rely on the Grande Prairie Hospital for their health care needs why these changes have taken place?
Good question. Minister of Health.
Thank you, Mr. Speaker, for the question. We all know that this is a problem that we've inherited from the past government. Of course, part of that has to do with the fact that announcements were made without doing due planning, and our government is really committed to making sure we get it right moving forward. In terms of what the official opposition proposed during the election, let's just remind ourselves they wanted to cut over 3,000 civil service jobs, and their leaders said, we will cut lower priority infrastructure projects, Honourable Speaker. So I want to know, are those Lloydminster Continuing Care, Medicine Hat Regional Hospital, Tabor Healthcare, Grande Prairie Healthcare? I don't think so. Our government's investing in infrastructure.
I'm getting really tired of the fear-mongering from that side and the mistruths. Given that in a meeting with myself, the member from Grande Prairie Wapiti.
Honourable Member, preamble, and be careful of the choice of your words.
Given that.
Be careful of the choice of your words.
Given that in a meeting with myself, the member from Grande Prairie Wapiti, and the Mayor of Grande Prairie on September 9th, the Minister clearly stated that rumours aside, the hospital was on time, on budget, and definitely not going to be scaled back. And the Minister suggested that it would be a good question for question period, so she could proudly proclaim in the House those same statements. So, Minister, here we are, as per your suggestion. Can you explain why you made those promises that you have now reneged on?
I was really proud to tour the province this summer. The honourable member did not bring staff to that meeting, but I did, and we have very detailed minutes of what I said in that meeting. I'd be happy to share them with the honourable member. What I did ask were what rumours are in the community and how can we set them straight? And the rumours that were in place included that the whole hospital was going to be shelved in. We are not doing that. We've got a plan. I announced it very publicly yesterday. I reached out directly to the honourable member yesterday and to the mayor and to the Grande Prairie College and Health Advisory Council. We're being very open about what we're able to do and how we're moving forward, Mr. Speaker.
Given that during that meeting, the member from Grande Prairie Wapiti supported your statements, Minister, showing that there is little or no difference between the previous government and this government in their commitments to infrastructure, how can the people in the Peace Country, and in fact all Albertans, have any confidence in anything this government promises when rumours and coffee shop talk have more credence than the minister's own promises?
Province, I've been inviting local MLAs to join in the meetings I'm having with other local leaders. And if the honourable member doesn't want to be in those meetings and wants to make up untruths, I am very willing to take that into consideration. What the honourable member is